It is 6:38 right now, new this morning as coronavirus trends continue to somewhat flatten across North Alabama. Health experts express their concerns about potential spikes in case numbers as we approach Labor Day weekend.
Joining us right now via Zoom is Crestwood Medical Center CEO Dr. Pam Hudson. Dr. Hudson, good morning. Thanks for joining us this morning.
Good morning.
You mentioned during Monday's briefing 4 key takeaways: masking, separating, sanitizing, and accepting no compromise. You really pressed that last part, Dr. Hudson. Explain what you meant by accepting no compromise.
Well, I appreciate the opportunity to say again, masking, social distancing, and sanitization are really the 3 key public health measures. And the 4th that I think is really important for us and our community now is accept no compromise. When we start to waffle on who should wear masks and how often, what is the right size of gatherings, how much sanitization, that's when we really need to focus and do what the science is telling us. And so that's what I mean by accepting no compromise. Really think hard about the things that we do normally and how we have to do them now until there's a safe and effective vaccine.
We know football games, other fall sports now in effect, the carnival at Toyota Field. As a mother yourself and as a health leader in our community, what can you say to other parents and families attending these events?
Well, I think it goes back to the distance and separation, key issue for our community, and that is to avoid large gatherings where you cannot assure safe distancing. So that puts some personal choice at the very forefront of how families decide what they're going to do. And while that is personal choice, keeping those 3 things in mind, if you go someplace and people are not masked, if you go someplace and you can't assure that you can have that distance to keep your family safe, or if you go someplace and you see that their sanitation measures are not up to par, then avoid those gatherings. The folks that organize them will very quickly get the message. They aren't intentionally, I don't think, being less than what the public health measures call for, but we can have some influence on that. School is so important to our children. The activities that go along with us with that are really the key and can create a great deal of risk, and every school and every activity leader are wrestling with that right now. So keeping those things in mind is really key to our success in avoiding the next spike.
As you know, Dr. Hudson, and you pointed this out to the other day about convalescent plasma as a treatment for those that really need that help right now that are suffering from coronavirus. How promising is that, especially that we have that in this area now?
Well, actually, we've been using convalescent serum really since, I think, April. Our physicians in the community were enrolled in a research study, a trial that was helping to gather some of that data and give that back to some of the key universities in the country. So our community members have had access to that essentially from the very beginning. I was looking a little bit at some of the data yesterday, and while the FDA has given the emergency use authorization for it now, so that every hospital and physician who wants to use it is able to access it, the issue, I think, is there's not enough data to say that it's really working. There's probably enough to say that it's not harming. And so we will, as the use of it expands, we'll get better information. But it is hopeful, just as the remdesivir and the dexamethasone and the things that our community has had access to. We're so fortunate that we've got top-notch medical care in this community.
That is great to know. The health leaders leading every step of the way right here. We do appreciate your time. Dr. Pam Hudson, the CEO of Crestwood Medical Center, thanks again for joining us this morning.
Glad to do it.
All right, thank you. It is 6:42 right now.